Around 1 in 10 Americans have a rare disease. That's more than 30 million people. And to put that into perspective, if they all held hands, they could circle the earth 1.5 times. But let's stop for a moment. When we think of the word rare, we often think of something small and insignificant. But let me tell you that those living with a rare disease face challenges that are anything but small. This year has been my last year of high school, and throughout the year, I've been poked, prodded, tested, and undergone treatments that majority of people won't ever face in their life. This world simply wasn't designed for me to navigate. But the reality is that my story began when I was a year old in India, where I was diagnosed with progressive familial intrahepatic cholestasis, which is a severe liver disease, and for short, it's called PFIC. Now, the first thing that doctors told my parents was that I wouldn't survive. But my parents did not take this for an answer, and they made the long and difficult journey of giving up their jobs and their homes to move across the world and get me access to treatment. But the issue is that so many people living with a rare disease don't have this option. And I'm not just telling you this to gain your sympathy, but I'm telling you this because there's something much larger at stake here. In fact, the NIH estimates that more than 400 million people live around the world with a rare disease. And to put that into perspective, if everybody with a rare disease lived in a country, it would be the third most populated country after India and China. And yet, rare diseases are thought of as something of the last priority, not just by policymakers or healthcare professionals, but by us, the general public. And yet, rare diseases are so much more than that. In fact, what I found is that through my journey of rare disease care, there's actually a large paradox. You see, on one hand, we're invisible to the doctors who rarely come across a patient with a rare disease, let alone treat a patient with a rare disease. We're invisible to pharmaceutical companies who won't invest in specific rare diseases because the profit is too small. And we're invisible to policymakers who won't make changes because our voices are simply invisible to them. But on the other hand, we are simply impossible to ignore. And rare disease patients don't just have that for themselves, but they have it for everyone around them. And I know this firsthand because living with PFIC, my rare disease hasn't just affected me, but it's affected everyone around me, my teachers, my parents, and my family, first and foremost. Because rare disease patients push impacts that ripple outwards. They bring in caregivers, educators. They bring society to confront how we push people that are underserved and sick at the lowest priority. And here's the kicker. 2/3 of patients living with a rare disease in America are children. And these children are people that might not even make it to high school, let alone middle school. These are children who might not meet the major milestones that it means to grow up. These are children who have to fight for their care again and again, not because they want to, but because there's no other option. We often erroneously think of leadership as something that occurs in government buildings or in industries that are governed by experts. But let me tell you that some of the best leaders I've met are in fact kids. Kids who have had to explain their rare disease or their condition to the nurse who simply can't relate to them over and over again. Teens who have had to advocate to doctors to receive better treatment because their life depends on it. Young adults who've had to make the difficult decision of prioritizing their life or their passion. That is what rare disease patients have to face every day. And I know this firsthand as well, because living with a rare disease, I've had to become an expert in my own condition. I've had to advocate on the international level, at the state level, And I've had to advocate to doctors continuously to receive better treatment. And the issue is that rare diseases isn't just about us, because it's about everybody. It's about all of us. It's about what we value as a society and who we decide to give resources to. Because the fact is that as a society, if we come together, we can make that kid's life who hasn't been diagnosed with a rare disease just yet so much better. Now, you might think that you would have to be a doctor, a lawyer, or an expert to make change within the community. But here's the point. You don't have to do something about this. In fact, there are 4 things you can do to make a change within this community. The first is by listening. When rare disease patients tell you their stories, simply acknowledge that just because it is uncommon doesn't mean it has less importance. And the second is by amplifying and sharing those stories. Instead of just listening, share that to your network. Educate people about rare diseases from what you get from patients. And third is advocating for better policies. You can go a step further and testify and do many other things on your behalf. And the fourth is by supporting organizations that help rare diseases, that fund rare disease care, organizations that give critical access to resources for patients that are financially insecure. And the fact of the matter is that whether or not you are an expert or you work in the field of rare disease change, rare diseases isn't just a medical issue. It is a leadership issue. It's a social justice issue that young leaders, teens, kids, adults even, are helping fight the change. Because the second we realize that rare does not mean forgotten, we can make significant change. And so the question is, will the rest of the word follow, and will you follow? Thank you.